going to share this pragmatic response with you in the Western Cape. And as I say, there's not a book that's been written on this. This is one of the greatest disasters of, let me say, of my time, and require an extraordinary response. And as we learn, and I think we are learning now because we are running further down this pandemic than the rest of the country. They say the Eastern Cape is about 2 weeks behind us. We're planning to get the peak in the Western Cape by the middle of July. And every day is a learning experience, and you don't know, are you too over prepared or are you too under prepared? If you're too over prepared, you're going to be crucified. If you're too under prepared, you're going to be crucified. So let's see. Okay, effective waste management is crucial towards the containment of disease and the spread of this, and so it's very, very important that you keep that in mind all the time. And I'm going to share it with you within the following framework. We're going to look at the waste management risk and challenges experience, then the guidance we gave on waste management practices, then the coordination on waste management collection, disposal, and treatment. Then very, very important is the health and safety of our workers. And then also it was very important to assess what is the available treatment and disposal capacity in the Western Cape. And then there was also a support program for the waste pickers because they were severely affected by this pandemic. And then a summary, what have you learned so far of this pandemic in the Western Cape? And waste workers are second in line just after the health workers in fighting this pandemic. So keep that in mind. And we see a lot of countries has done a lot actually protect their waste workers. Even in a country like Britain, they've given them a special dispensation during this time because they've been seen as very, very important. Now, we were not prepared at all for this. And initially, when we heard about first this COVID-19, the novel coronavirus, it was very far, it was at Wuhan. The only time that it becomes more real was when South Africans who was living and studying and working there was affected and they were arriving in our country. And then suddenly, there was this big buzz and the president announced this hard lockdown. And suddenly, we can't work from home. And it was very, very difficult to sort of adjust to this new paradigm that we experience. So we had to bolster our capacity to work from home, designate staff as essential workers, otherwise you couldn't move around and do your work. And then to set up infrastructure and systems, and communication and coordination. And although we always said, no, we want to go paperless and we want to go do everything electronically, we never did it. And I think that's pushed us. I think we're never going to go back to the previous times, how we do our work, how we travel and stuff like that. So maybe there's a lot of positive spin-offs also from this. Then especially how do we do the combination and coordination? And I've become intimately aware now of MS Teams, all kind of platforms, and we're going to do a lot of our workshops and seminars using this. Then we realized that municipalities at this stage were in a mad spin. And we were fortunate to have very competent municipalities in this province, and I'm so grateful for that. But we realized that somebody has to lead and do something. So we quickly get together, and we decided we need protocols and guidelines. The protections of the waste workers is something that's not negotiable. And then another thing that's very important is to identify the location of the COVID-19 cases in the hotspots, because this is very important for a targeted approach. Because if you start special arrangements and practices, it's very, very expensive and time consuming. It's impacting on your service delivery. And it was very, very important to identify where are these areas. And in South Africa, there's very strong legislation on patient confidentiality. And initially we had a big fight with health. I think we come to a compromise that it's easy for us not to identify, not the household, but to identify at least the hotspot to work in, because this is crucial towards your targeted intervention. And then we had to look at, as I mentioned, have you got enough treatment and disposal capacity? And then also the problem was the waste pickers suddenly will have any outcome, and they were severely affected, and what do we do to assist them? Then with the development of the protocols and guidelines, the first one was actually, what do we do with households now? If it was in hospitals, we're fully confident because we had a very good healthcare risk waste system in the Western Cape. We've got legislation covered, and we've got a manifest system, we've got an information system on which they report to. But how do we deal with the households that was affected by positive cases, COVID cases? And we scrambled. And we had to do a lot of research. The other one that we developed, and this is further down in the pandemic. So the first was to deal, we know the hospitals were okay, first to deal with households, how do we deal with that? And then after we start saying now to create additional capacity, they started with quarantine and isolation facilities. And they were not normally facilities that's dealing with healthcare risk waste and infection control. So we had to write a practical guideline to assist them. And then after now, when we enter into level 3, risk level 3, more people will start going to work and the economy were opening up and people were saying, oh, what do we do with the PPE? We're so grateful that they wear it, but what do we do? And we can't cripple this economy for things as unnecessary and where there's not a big risk in dealing with that. So I had to find a way that's practical and it's implementable and that that can also be afforded. Then to develop these processes and guidelines, remember, as I said, this thing hit us from out of the blue. We haven't got a clue at that stage. So we found around frantically, provincially, nationally, globally, learn from other countries, institutions, associations. And I was about a year and a half ago in Italy, and actually in that part of Italy, at that stage, Italy with the eye of the infection. And I had very good relationships now, professional relationships with that part in the Lombardy area. And I quickly learned from my colleagues there what they were doing, and we learned from them. We learned from the International Institute of Solid Waste, and we, as I said, we tried to find out and then come with something up. We follow the risk-based approach to identify the risk, but also to look at the practicality and the cost of it. And then we develop it also through a consultative process with the municipalities and the provincial Department of Health. Some of the material that help us along, and that, okay, I'm not saying I'm an infection control specialist. I did do my time a little bit with the Department of Health. They were my previous employer, and I did infection control for them. Also as part of my environmental and occupational health duties. And what's very important when people sometimes use COVID and the coronavirus interchangeably. What's very important is COVID-19 is the disease. It's, when you talk about the virus, it's the novel coronavirus. And the official name of it's the SARS-CoV-2. And this is a member of a group of viruses that's wrapped in a lipid layer like an envelope. And that's very, very important. And it's also very important to know that there's a big difference between a virus and a bacteria. Bacteria is a living thing. A virus thing is dead. So you can't really kill it. So once this thing enters your body, it's like it's a hijacker enter your car and it's now started wreaking havoc. But once outside of the human host, this lipid layer, like a fatty layer, disappears, and then suddenly this thing is delicate and it doesn't live very long. And what I try to use it here, and I use here something from research done by Sally Brown, who's a professor at the University of Washington. And what I've tried to do is to show you here is the enveloped viruses. And they come in a class of hepatitis B, HIV/AIDS, and the normal flu virus. And just a little bit higher, you will see we in the Western Cape, and the Cape Town is the TB capital of the world. There we deal with TB. So if you look at the level of disinfection and environmental destruction, so the effort, you will see they comes very, very low and on the class of pathogens. So even like Staphylococcus and Salmonella, that normally gives rise to food poisoning, it's higher and more difficult to treat. So it's very important when you deal with this virus. I'm not disputing the fact that it's highly contagious, but you also have to look at in relation to the risk that this pathogen is posing. Then we also looked at the New England Journal of Medicine. This is a very credible organization that we normally learn a lot from, and you will see how long does the coronavirus live. In air is about 3 hours, copper 3 hours, cardboard 24 hours, and then on polypropylene plastic 3 days. And we use that as actually our guideline in determining our risk in our protocols. So the first protocol which we developed for households with COVID cases, it covers the following: designation of the workers, essential workers, waste containment, storage, handling, separation. We don't allow any separation of waste allowed at these households where the COVID cases is staying. And then awareness is very, very important, that the households would know what is the disposal practices, and the collection personnel should be made aware of the risk and the waste they're working. and the protection of the waste workers and the households is also very, very important. In this case, what we said is that your COVID waste is kept separately. It's kept in a black bag because initially we want to use all fancy counter bags, but we were scared for stigmatization. We know that the first time when it came out that the single mother in Kailisa was COVID positive, a landlord threw her out of the house. So we're very sensitive towards that. So we don't want to advertise that this is a waste with a risk. So we kept it at black bags. And then when it's 3/4 full, it's being tied down and put in another bag. And we then tried, at that stage, it was still in the summer. We're now in winter. And we tried to keep it then outside, in the outside area, and with the heat, within 72 hours, that virus would be dead. And we were actually asking it to keep it for 5 days. And we have asked municipalities actually that once they collect it, to keep it at transfer stations or material recovery facilities for a couple of days extra before it's disposed then on a normal landfill. And it seems that we've been doing this since then, and we don't have a problem with that. And it really drives down the cost dramatically and is practical. Then, as I said, as the pandemic progressed, we had to look now at isolation and quarantine facilities. And there we looked specifically at the healthcare waste legislation, and we covered it from the provisions of the legislation and regulations, and we tried to make it very, very practical. And you'll see the following areas that we cover, and there's also record keeping of this waste stuff. Then further down in the pandemic, after level 3, as I said, as the economy starts opening up, and more people are going to work, we realize that we have to do something. Now, in most cases, people are wearing actually cloth masks, and we actually prefer the cloth mask. That's okay when that is washed frequently. In this case, people were still using disposable masks, so we had a similar protocol we put in place. We then say, when it's 3/4 full, it's double bag. It's then stored for 3 days before disposal. And we also got provisions for the cleaning personnel with PPE and training, and the cleaning of that specific area is very, very practical, very cost effective. We implemented, and it seems to work. Then very important was, how do we coordinate the waste collection and disposal in the province? So we quickly established intergovernment waste management workstream, and we get together on the online platforms, and we met weekly with the waste managers, and we kept since the start of the pandemic, and we're still doing it, and it's very successful. We also had a meeting with the environmental health practitioners from the district municipalities and the provincial department of health and the metro. We've since then collapsed it now into one, because we've got lots of work to do, seeing that we bear the brunt of the pandemic and we don't have a lot of time to spare, and it works quite well. Then the functioning of what does these work streams do is the coordination of the services, to deal with challenges and share best practices, because there was also a lot of that, and we shared it with the rest of the country. I know the National Department also developed a WhatsApp group, and we share some of our documents and best practices we have with them, with the rest of the country, and we provide technical support to the municipalities wherein we need it. We also established our own WhatsApp group, and that actually worked fantastically, and no jokes has been shared there on that yet. And it improved the coordination, sharing the information, and quickly get information out there. It's very, very nice tool actually to make sure that everybody know what's happening, and also to share a bit of victories that we have during this time. Then, as I said, very, very important personnel, your health and safety for your waste workers. And we try to make it that's a non-negotiable, strict adherence to hygiene norms, including cleaning of PPE, provisioning of gloves, masks, and overalls. And a lot, initially it was disposable, but they quickly moved away. It's very expensive practice, and go to others that can be daily changed and cleaned. Social distancing is very, very important. It should be applied in the changing room, the meeting rooms, and in the cabs of vehicles. And at that stage, we didn't know how difficult it is. In a lot of cases now, we had to halve the people on the truck. So it means then the workforce, half of the workforce will be working there. And I'll talk later about the infection of some of these workers. And now if you suddenly have infection, it was a difficult challenge to deal with. And very important, you must also look at your vulnerable staff, taking your health, your comorbidities, and your age into consideration, and use them not in the front line. And to avoid direct contact with bins and bags, and disinfectants and hand sanitizers for hygiene practice should be available. We must teach waste workers to retreatment, wash their hands and increase cleaning, and then also to sanitize and disinfect the drivers' cabs after each work cycle. And very, very important, as I said, non-negotiable. Here's a couple of photos now of waste workers in action. This is more the smaller towns, but we can see they're using it and they utilize the best practices. You'll see on the left-hand side, the lower one is where the areas are being cleaned at waste facilities. And then we have to make sure, do we have the necessary treatment and disposal capacity available? Now we're fortunate to have 4 licensed healthcare waste treatment plants. One is an autoclave, one is the ETD, electrothermal deactivation plant, and 2 incinerations, one here in Cape Town and one in George. We've got 71 operational waste disposal facilities, and one is a hazardous waste disposal facility. So I think for facilities-wise, we're sitting in a comfortable position, and we are monitoring these facilities by environmental inspectors and also through internal and external audits. And you will see on the right-hand side, there's photos of our EMIs going out to these treatment facilities and making sure that we keep us honest. We do compliance promotion at this stage, and we also do compliance promotion at hospitals and these isolation facilities. Of course, we don't want to disrupt, we want to help them along. Now, currently, we can never say with this virus, as I said, we're hoping that we will experience the peak in the Western Cape on the middle of July. I think it's not the 100% correct figures, but I think the day before we were sitting at 44,000 cases in the country with 73,000 cases. And we don't know how the numbers will increase. As I said, we will use the guinea pig in South Africa. And with the National Department of Environmental Affairs, Forestry and Fisheries, and we've also identified other options should we run out of with the treatment facilities where we should dispose as a plan B. And then, as I said, the waste pickers were suddenly deprived of income, and it was terrible for them, and they couldn't move around. And then the National Minister of Forestry, Fisheries and Environment, she took pity on them, and she started quickly with a food voucher initiative, and each province received 500 food vouchers that could be redeemed at a couple of retailers. And you'll see it was sponsored by Coca-Cola, Plastics SA, and other PROs. If I left anything out, please excuse me. And I apologize beforehand. It was a total of 785,000 that's donated. It was a drop in the ocean, but at least there was some support. I know there's further talk from the National Department that they're working with other organizations to now provide PPE and do a lot of awareness amongst the waste pickers. And you'll see the waste pickers, I think there's between 60 and 80,000 in South Africa that's operating, and they're very, very important for waste diversion in the country. So we really treasure them and really recognize them. What was very difficult is now suddenly, because we're required to get ID numbers and cell phone numbers, and it was a very, very difficult exercise. We tried to verify it, and we struggled quite a lot. So we've seen that we'll have to work much, much closer in the times to come now with this group. They are very, very important sector in waste management in South Africa. Then what have we learned so far? We can see there's the decline in waste generated and disposed. We've seen now in level 3 that there is pockets in the area where it started picking up, and this is a good problem, good challenge to have, because we know then the economy is picking up. But initially it was a decline in it, and there was an increase in illegal dumping because not all the facilities were open because you couldn't travel around. They started opening up now in level 3. And there was a big increase in the healthcare waste generation. These figures that I got it actually from the National Department. So thank you to Michelle Governor. And I've got the stats for the whole country, and this is not the healthcare waste in total. This is just COVID waste, as we coined it. So you'll see for March for the total country, this is in kilograms. It was just over 6 tons. In April, it was 105 tons, and in May, it was 221 tons. And I think now in June, it's going to increase dramatically. Of the Western Cape, you will see it was not even a ton, and then it jumped in April to 12 tons, and then to 71 tons. And I can tell you that there was about 6-fold increase from April to May, and I do believe that's going to be the similar thing when we start talking now of the June stats. Then we also start suddenly seeing increase in the efficiency in waste workers, and we were so scared what's happening. So we're seeing for the province, and that was on Monday, and it can be that the increase since then. But at that stage, it was 85 cases over the province. You will see how it is distributed. The bulk of it from the city of Cape Town. That's also the bulk of the waste and where the bulk of the people in the province are staying. And you will also see that in the smaller, like Bergriver, Drakenstein, Stellenbosch, Witzenberg, Clear Valley, Langeberg, and also George and Knysna has experienced a couple of infections. And this was havoc when this has happened. So we quickly say we have to check that everything is still in place. Are our protocols working? Are people using the PPE? Are they doing what they're supposed to do? So we run a quick survey, and there's a 56% participation. Unfortunately, the city of Cape Town didn't participate in the survey, but we're now going to run the survey every 3 weeks, and to make sure that we cover and all the time monitor this. And we'll see that the people that primarily that got infected, that's the frontline waste workers, and it's the workers involved in collections. And mostly it comes from the communities, but we suddenly start to realize how important is the social distancing in the cabs and how difficult it actually to achieve that. And we're working very hard on that. And as I said, we didn't have a blueprint for a response for this pandemic, and we suddenly realized municipalities didn't have contingencies in plan, because what's happened, that whole depot is being closed now. Suddenly there's no facility or service for to render removal services. And being government, you have to follow certain procurement procedures, which is quite difficult. There is allowance for emergencies, and we're trying to use that also. So what we do now is we protect the waste workers. They would start in a staggered start. They work on a rotational basis. We put them in pots or bubbles, and we keep them and protect them, because the moment the bubble is now infected, it means everybody that's been in contact with this bubble is suddenly not working. And we have cases now in George where there was for 14 days a certain part of the town couldn't be serviced. So we're working very hard on the contingency to make sure that should something happen, that they're right and that they can have a service for the communities and their businesses. Then what have we learned so far there is our services continued. And as I said, we have currently, I didn't want to say until the pandemic, but currently we have enough capacity. And we also start looking now at using alternative waste treatment to bring the cost down. I'll talk a bit later about that. And the municipality workers were provided with PPE, and they're using the PPE, and we're trying to monitor it, and we try to use their environmental health practitioners from the districts to help us also to monitor that. We've realized it is having a severe economic impact on the private sector and on the municipalities. Really, we're going to start feeling it now as budgets start being cut, even at the provincial level. And we've seen especially the informal sectors and the waste picker was terribly impacted. We've seen projects that we've been run for 13, 14 years. Suddenly, there's a big challenge now because of this pandemic. So I think the after effect of this pandemic is going to sit a long while with us. Then what has happened further now in the process to prepare for the peak of this pandemic, we started identifying now other temporary facilities. If you've ever been fortunate to be at International Convention Center in the city of Cape Town, it's really a sight now to see. It's converted. The one part is converted in a field hospital for 860 patients. The other part is also converted in the process of being converted, and there will be 696 patients. And then close to Brackenfell, where I stay, there's also a big industrial premises, what they call the Brackengate Hospital, where they will have, say, 340 patients. And we're going to start using alternative technology. But about 3 or 4 years ago, we piloted with the Provincial Department of Health technology that comes from Italy. They call it the Municipal technology. And I showed you the smallest one in the range, and I show you a map on the right-hand side in the countries which we were using it. And this is using very, very simple. The first time when I've heard of it, I didn't take it seriously. And as I investigated more, I became more interested. They're using friction, and it's generating heat by the impact and friction of the waste, and it can go up to very close to 160 degrees C. And the residue obtained is sterilized, finely ground, and reduced in weight and volume. And what's nice is the protein sort of seem to disappear because of the heat, And what's say as a residue is actually it's mainly plastic. And so the RDF value is quite high. You can use it as RDF also. And I really want to use this in waste to energy that's still needed maybe at hospitals. So the benefits is actually reducing the waste facilities cost for disposal, improve the safety, reduce the waste quantity, reduce the environmental impact, and reduce the infection risk of transport infection waste. What has happened now, the Department of Health ordered 6 of these machines, and we're in the process of getting authority from the National Department because they are the competent authority for hazardous waste, and we want to use some of the emergency provisions, Section 30A, to make sure that we install these facilities. There's basically no emissions into the air. It's a closed facility, and as I said, it's the cost saving is fantastic. And they say normally the cost of waste management, 80% is basically and collections and transport, and we cut down significantly on that cost is also. So we want to put it now temporary at these temporary facilities, and once the pandemic is past us, we will then decommission, and then it will go to hospitals where their proper EIAs will be done. And it's also not triggering any air quality legislation. Then we also realized that we want to maybe make sure that the pandemic also leaves a sort of a legacy. We in the Western Cape are really driving very hard to get out organic waste out of the waste stream. We set diversion targets and organic waste ban in 10 years. And as hospitals are now also being used as facilities where isolation is being done, another 9 is identified. One of the 9 will just be where vulnerable people will be staying, because they have no clue of dealing with healthcare risk waste. And so at this stage, they're not minimizing it at all, and it comes at a very, very high cost. So we're working very closely with them in the process of producing awareness material and pamphlets. We're also thinking of organic waste beneficiation, where we want to use, say, alternative technology. There's a technology that we investigated that we call BioBin. That's technology that's developed about 25 years ago in Australia, and it works quite nice. It was developed actually for treating infectious abattoir waste, and it works quite fine. And we will see where we can use this appropriately. Thank you so much for listening to me.
Thanks so much, Eddie. It's great to hear all the things that the Western Cape is putting into place, and some very interesting figures that you showed us about the volume of waste going up 6-fold for each month and things like that. Is that specifically from hospitals, or is that just in general the waste that's being processed?
This is just COVID-19 waste, and it was primarily at that stage from hospitals. I think in the later month, I think from May, it started getting also from the isolation facilities. But the first 2 months was actually basically just from hospitals and just COVID-19 waste, not the rest of the healthcare risk waste.
Wow. Okay. Good to know. There's a question from Linda Godfrey that says, can you explain this concept of putting the workers in a bubble to protect them? How do you protect the workers? If they're being infected within their communities and not during the work, how do you minimize the risk of infection?
Okay, Linda, you could, always Linda to ask the difficult questions. Thank you for that question, Linda. Linda, no, it's virtually impossible. If you don't take responsibility for your own health and your community, then you have a problem. But they try to do awareness and make sure that people at home also practice all these hygiene practices they have to do. And I think the Western Cape also follow now a sort of an hotspot approach, where they come in with a lot of people going out there and doing a lot of awareness to make sure that people protect themselves, and with a lot of awareness material. But okay, that you can't really protect. If you don't look after your health when you're in your community, unfortunately, you bring that to the home. But once you on your transport to work, this is where I can say the bubble arrangement starts. So you would keep the people totally apart. They would come at different times, start at several times. They would start at different facilities. They would rotate so they don't get in contact, because once you've been in contact and you've been, how can I say, infected, you affect a big part of the waste service. So we try to do it by staggering rotation and starting at different times and keeping people totally apart from one another, the waste workers.
Thanks, Eddie. There's a question that says, what is the approximate cost to the frictional heat treatment unit?
It depends on the size of the machine that you're using. I think once that's just over 500 kilograms, that's the listed activity for hazardous waste. If you're over that threshold, then you have to apply for a hazardous waste license. I think that's about 6 million rand. And if you look at the cost of that and the cost saving that you have initially, and even if you now start looking at thermal technology, you will see it makes sense to go for this technology. And it's been used for the last, I think, in Somerset West, the Mediclinic group also use it, but they didn't decide against it for using it. The Department of Health took the decision that they're going to try looking at these on-site treatment facilities because it has this massive cost saving. And I say the biggest cost saving in waste management, so other than the treatment, is the collections and the transport part of it, and that you reduce dramatically. And you also reduce your carbon footprint dramatically with these machines.
Thanks, Eddie. There's a question from Milzy that says, are there any educational tools, resources, or training opportunities that are currently provided for waste pickers?
Several municipalities have started with that. I know that the National Department is also working very hardly with the United Nations Environmental Program, and I also take part in that, and they've done great work in doing that. We are preparing some of the material, but individual municipalities has got different relationship with some of the waste pickers. Like in the Drakenstein area, they've done fantastic work there. They've started doing education, and where there's a close working relationship between the municipalities and the waste pickers, they would have done something. But where a waste picker is operating like the person scratching in the bin, unfortunately, from the municipality side or for government side, we haven't done anything at this stage. And I think that effort by the National Department, maybe now by providing PPE and maybe working with the PROs and the different associations, I think that's actually so much needed, and we would like to be part of that.
Thanks, Eddie. There's a question from Peter that says, what would you see as the strategic role of international organizations and NGOs in addressing some of the challenges we face?
I think absolutely support. And if there's countries, international organizations that have already been part where the pandemic has sort of also already run, and that's not been affected, and if there's any learnings that we can learn from international countries, that will be fantastic. If there's any material that can be made available, and obviously if there's any financial assistance, it will be great. It's costing this country a lot of money, and we've seen that even municipalities is going to very struggle to be sustainable over the next couple of years. And we see this industry, the private industry, is severely hit. So definitely material, expertise, and funds, any resources will be so welcome.
Then there's a question that says, can you kindly advise on how the awareness messaging was disseminated to the households during the waste management during the pandemic?
Yes, it was depending on, as I said, each of the municipalities are different. Some of them are a bit more rural. Some of them has used electronic media, some of them has used newspapers, some of them has used the community radio, some of them use loud hailers depending on the size of the community, some of them provided pamphlets, others are using things like Facebook and Twitter depending on the sophisticated of the municipality or the organization. We've tried to put together a sort of a guide of what happened in the Western Cape, and we also make it available to the National Department. But I must say that this group working on the United Environmental Program has developed quite nice material, and we would also like to have some of that material in the Western Cape.
Thanks. And then there's a question that says, how do you handle discarded masks and COVID-19 related waste in some streets, especially around slum areas?
That hasn't really been brought to our attention, that's the case in the Western Cape. If it is, I'm not aware of that. But obviously, if something like that happens, brought to our attention, we'll have to go and look, assess the risk, look at the practices, see what we can, and then try to start on a practical way of sorting that out. But that hasn't brought to our attention at this stage.
Thanks, Eddie. I have a question. You mentioned how one of the methods to try to prevent the spread was an awareness campaign, and also trying to separate organic waste from the general waste stream. Is the organic waste, is that a general issue, or is that specifically during this COVID time?
No, we're running out of landfill airspace in this province, as I think the whole country is running. I think we just realized it, and we tried very hard to manage the situation. We then adopt a policy of regional cooperation, and we're busy with 9 regional projects. We've also looked at our waste stream and our waste stream analysis, and we realized that 40% of our waste is actually organic waste, 22% is construction and demolition waste. And although we support the waste minimization and we believe in the Western Cape, waste is just a resource, it's in the wrong place. And our mission is actually an integrated waste service that supports a waste economy. So then we started with interventions on organic waste. We tried to understand the waste type better for status quo analysis. We tried to motivate the organic waste industry to work together, and then they put together an association for South Africa, Organic Recycling Association of South Africa, who's actually going from strength to strength. We put it on the national agenda because it was not discussed, and I think South Africa has made a lot of inroads already. We got a draft composting norms and standards that's waiting in the wings to be signed shortly, and we also got national norms and standards for organic waste treatment in total. If that can go ahead, we're going to fast track, we're going to really stimulate the waste economy, and I do believe that the informal sector can play a fantastic role here. They don't have to scratch in just in bins. They can work here, they can help with the transport of this waste up, and we do believe that we can have a great reduction in environmental impact of waste, also on climate change. And as I said, we want to create jobs in this province. So we were driving it very hard before COVID-19 came, and but we want to use this COVID-19 as a said event now, where we normally hadn't had close interaction with hotels now, because we got their attention, because they pay a lot of money now for dealing with food waste from these establishments. And we want to convince them now there's a better way where you can use it, when you can reduce your costs, when it's good for the environment, and also where you beneficiate this waste stuff.
There's another question that says, how did you deal with concerns of municipal workers regarding the handling of potentially infectious waste within the normal municipal waste? Is there awareness and training?
Yes, there's awareness and training. We shared a lot of documentation and work, even international material that I received from the company called Contarina in the northern part of Italy. We sent that, we used South African things that we have, and they quickly realized that if workers are scared, they're not going to do their work. A lot of workers initially were up in arms, and they had to allay the fears, and they only allay the fears of the person know exactly what are they dealing with this, what is the risk, and what is the mitigation arrangements that the employers put in work and put into place. Apologies. And there's also some municipalities that were working on a policy through SALGA for compensating the workers for like danger pay. And it's in some municipalities has progressed a bit further than others. It's creating a bit of havoc, but because the moment the one municipality is doing it, the other people are up in arms and doing that. And as I said, maybe we must learn globally from other countries. I know specifically that in United Kingdom, they've had a specific dispensation for waste workers during this time. But you have to allay the workers. You have to make sure that they feel safe to do their work.
Thanks, Eddie. Then there's a question from Umberto that says, was there any specific measure in place for people living in flats where there might be a lack of space to isolate the waste for days before collection?
This is an interesting question. Thank you for asking that. It was also similar, the same sort of condition, and the constraints were also felt by people in informal areas, informal settlements. And we had to make specific arrangements in different municipalities where the waste would be taken away. It would be assumed that it hasn't stayed very long, and it's been taken to transfer stations. So we had to increase the storage period before it's disposed. But although it was a bit inconvenient, but if you weigh up the cost by now declaring this waste type healthcare risk waste and taking it to the healthcare risk waste facilities, firstly clotting up those facilities, and the bit of effort now of getting a safe storage space, I think you can't compare the two. So they accepted it then, and then taken it for at least say 3 days to to a storage facility, because internationally it's known that the coronavirus would last for about 72 hours. So at least if you make sure that we build in attention time of 72 hours, we know it would be safe and it can be taken to landfill.
There's a comment from Henry that says, any recommendations on previous questions? How do you handle discarded masks related to waste in some areas and slums? I think Henry's referring to, if anyone wants to comment in the chat box, I think. Correct me if I'm wrong there, Henry. Sorry about that. Then there's another question that says, how is the food waste from the hospital wards dealing with COVID patients? How is that waste managed?
Okay, so what has happened is that in the hospitals there's a higher risk. So everything is seen that the patient has touched there is infectious waste, and that's going through the normal process of being treated at one of these off-house plants. So if they can, maybe in some cases, yeah, they would use disposable sort of cutlery and stuff. In some instances, they don't. If they don't do disposable cutlery, it will then be cleaned and normally sterilized in the hospital. But the waste is being seen as I said, isolation waste, infectious waste, and being taken away. But Henry, maybe I didn't get your question so well at that stage. As I said, I'm not aware of PPE that's being dumped all over the problems, masks and stuff like that. But that's why we try to make provision for business and institutions to have a policy for doing it. But I've seen it on the internet and on Facebook that they say a lot of these things have been chucked everywhere. But as I said, it's never been reported as a problem that we experience in the Western Cape. But we did make provision for it when it's in a business or an institution by providing a protocol how it should be dealt with.
Thanks, Eddie. There's another question from Nozi that says, how do we advise communities that do not receive municipal waste services? How should they correctly dispose of their gloves, masks, tissues, etc.?
We can share it. If you're okay with our protocol, we can share it and make it available. As I said, I've shown you in part of this webinar how difficult or how not so difficult it is actually to kill off this virus, and that it easily, without intervention, die in the environment outside a human host within 72 hours. So if you keep this, and as I said, we keep it in double bag for 3 days before it's taken away, there's basically no problem taking it to a normal landfill. So if anybody, we can share all these protocols if you're interested, that we have the one on COVID waste from homes, the protocol that we have on managing PPE waste at businesses, institutions, and also the one in INQ, the quarantine and isolation facilities. If you're interested, we can share it.
Hi, Eddie. I think sharing it will be a great idea just to spread the word and get the key messages out there. There's a question from Philippa that says, what is the approach with schools waste? Are there different protocols, or is it processed as usual?
Department of Health has put together a whole guideline with dealing with infection control, with business and stuff like that. They had a little bit on waste. We took it out of that, and because we're the specialists on waste, we started looking and we give body to that. But that's actually taken into the whole Western Cape government response now, and each of the institutions, irrespective of where you are, that's being the protocol that will be used. But in most of the cases, as I say, that most probably schools will not use gloves. In a lot of cases, they will have cloth masks. So there is actually the hygiene and the regular cleaning is actually the protocol that will follow. But if disposable gloves or disposable masks is being used, they will follow this protocol in the Western Cape.
Thanks, Eddie. At this stage, there aren't any more questions in the chat box. So if anyone has any further questions at a later stage, you're welcome to email us at SST and we can pass those along. Or Eddie, are you happy for people to email you directly?
More than welcome if I can help, if anything that we've done, and share. Even if you want to share what has happened in your area, it'll also be nice, because we must learn from one another. And yeah, this is, as I said, this is one of the biggest disasters of our lifetime, and we must assist and learn from other people in other countries, really.
Very true. It's definitely interesting times that we're living through and quite unique. There are a few comments that say, thanks, Eddie. Great presentation as always. Good to see the work that's happening in the Western Cape. Thanks so much, Eddie, on behalf of SST, and thanks everyone for joining us today. I think it's great to learn as much as we can about the virus and how to prevent the spread. Yes, so thanks everyone, and I think we'll close it here for today. Thanks again, Eddie, for joining us, and the session has been recorded and it will be available on the SST YouTube page after the session. So we will be emailing you the link to that. Thanks everyone, and thanks Eddie.
Thank you, and thank you for the kind words, and thank you for the guys who's dropping by to listen. Thank you so much. Thank you for the interesting questions.